Something that I look at right away is the skin and the umbilical cord. So let's take a look at the skin. And if you take a good look at the skin, you can see that it's marbled. It looks like regular marble in your home or at work or wherever you are. You can see the marbling of the skin. Do you see it's all marbled? And that's called medically cutis marmorata, which means marbled skin in Latin. And actually, all of our skin is marbled like that, but they have such thin skin that you can see through the skin to the marbling. And as we get older, you can't see through our skin, but that is normal skin. So the next thing to do is look for any rashes that they have. And newborn infants always have rashes because their skin is so very sensitive. So you can see that there's some red marks here. That's normal. They come and go. You can see over here that we have dry, flaking skin. That's normal. When they first come out, they're first born, many times the parents are concerned that they have dry skin because it's flaky. But they all have dry skin, and it's from staying in this amniotic fluid, even though they're covered with vernix to protect themselves, which is sort of like oily substance. Still, they're dry. But this will all flake off by itself, and a tip is never peel it off. It'll fall off naturally, and to lubricate the skin, you can use baby lotion from the neck down, but not from the neck up. Okay, so let's look on the face. That's another typical area where you get rashes all the time. And you can see that there are some red spots. They'll come and go, and that's normal. The other thing on the skin is you can see these white dots. That's called milia, and it's just clogged little glands. And after a few months, that will go away. Okay? The umbilical cord here, you see, looks nice and dry. You can leave it alone. Sometimes, if it's a little wet, I ask parents to put a little alcohol on there 3 times a day. And the way you would do that is take a bottle of rubbing alcohol from the pharmacy, put it on a sterile cotton ball, and then just dab right on it. And you could do that 3 times a day. But this is dry, so it's fine. People ask me, well, what kind of alcohol do you buy? And I always say that it's the only kind of alcohol you can buy in a pharmacy. It's rubbing alcohol. Okay, and then you can see the nice hair and coloring. She's gorgeous. Infants are frequently born with a reasonable amount of hair. That hair falls out, and you'll find it all over in the comb, in the bath. But at that same time, you'll get new hair coming in, and you may not even notice that the initial newborn hair is falling out because you'll get new hair coming in. Also, you can notice that the infants have hair on their shoulders, and that's called lanugo, and that hair will fall out. They're not going to look hairy like that. In the process of growth inside the mom, yes, we're talking for a long time, aren't we? They actually have hair everywhere. So now the next thing is the examination of the heart. And the heart sounds sound nice and regular, and there are no murmurs. Perfect. And the next thing that I do is look in the belly and feel the belly to make sure there are no masses inside here that there are not supposed to be. Okay, that's great. And next we're going to look in the ears. Okay. There we go. Perfect. That ear is great. Perfect. We're going to look at the eyes and make sure that the pupils react to the light and get smaller with the light. They do. We look at the color of the whites of the eye to make sure they're not yellow, because sometimes they already are jaundiced.
Okay.
And if you hold on just 1 second. Okay. Now we'll look in the throat.
Okay.
Great. There are no clefts. Sometimes children will have the roof of the mouth not formed all the way.
Okay.
Next, we'll feel for the soft spots. Some people get worried that they'll put their finger through into the brain, but you won't do that. Okay. Next, we'll look at our fingers. Perfect. And we'll also look for the creases in the
On the palm?
exactly, to make sure that it doesn't signify any kind of inherited disease, which it doesn't.
Okay.
Okay. Next, we're going to check the hips. The examination of the hips is very important because we want to make sure that the top of this large femur bone sits into our hip socket. So if this is the femur, if this is the big bone, the head of the bone has something that looks almost like a baseball, and it fits into the hip, your real hip. It needs to be in place, and we need to make sure that it's in place at birth, and you'll see us flexing the knees to feel the hips. If it's in place, this head of the femur helps the acetabulum, that's the part of the pelvis, to form the right way. But if the head of the femur is not exactly in place, then this acetabulum from the pelvis doesn't form the right way, and you can have permanent damage done to your hip joint. Because it's very important that the hips are in the correct position, and I'm making sure that they are, and they are. Now, in the genitalia of the female, at birth they always have a little mucus and sometimes some drops of blood. You can clean that just with a little bit of soap and go straight down.
Okay.
You don't open the vagina and start trying to clean inside. Just go straight down. It's perfectly normal. In the female genitalia, we have the vagina, and you'll notice that there's frequently mucus and sometimes even a few drops of blood. I remember back to being an intern, and I was called to the nursery to see an infant because there was some bleeding coming out of the vagina, and it was a new nurse who didn't realize that that was normal, and I was a new doctor, and I didn't know it was normal, and I actually pulled the cord to cause everyone to come to the baby thinking that there was something seriously wrong. But in fact, it's quite normal, so don't worry. And that comes actually from the mother's hormones. The mother's hormones are high, and just like a period for an adult woman, the reason that a woman gets a period is the hormone level goes down and then they have a period. Well, the hormone levels in the baby from the mother through the placenta are high. At the time of the cutting of the cord, immediately the baby does not produce female hormones, the hormone level goes down, and the baby will have drops of blood. It's just like a period. So that's normal. To clean the vaginal area, you just take a wet cloth, maybe a little soap, but you hardly need soap, and just go straight down. Don't go trying to open the vagina and clean that out. For the male, many of the infants have a circumcision, and you can put either bacitracin ointment around that or A&D ointment around it, and you would want to do that at every change. I haven't really ever seen one of those circumcisions get infected. The reason for putting the ointment around there is not primarily for infection, but it's to make sure that the drops of blood that will come out of the circumcision site during the first few days of life, that those drops of blood don't touch the pamper, stick to the pamper, dry up, and then when you take the pamper off, you're then taking off the little scab that's forming, and then you get a lot of blood coming out, and you'll certainly be concerned about that, and we don't want anybody concerned. So at any rate, please put on some either A&D or bacitracin ointment around the site of the circumcision until we here in the office give the okay that we think the circumcision is healed and you're off and running and do not need your ointment anymore.
Okay.
And the anus is perfectly normal. Now I like to turn them over and check the back just to make sure that the back is okay. And you can see that there's a little bit of a dark spot, brownish spot here. That's a Mongolian spot, and that's also normal, but will take months to go away.
Okay.
Months.
Okay, baby.
Okay, and let's look at the feet. Okay, and that's it for the newborn exam.
Okay.
She's
okay,
done
okay. Okay.
quite well. Her exam is totally terrific. So I'm happy about that.